If you're not releasing eggs and you're meeting with your partner monthly, then there's no egg for the sperm to fertilize. And that's why women with PCOS end up struggling with having babies.
But you knew that
1 in 10 women will suffer from this condition globally. So of course we're going to talk about PCOS. Hi there, I'm Dr. Williams at your cervix, and today we're going to be discussing polycystic ovarian syndrome, aka PCOS. If you're new here, my name is Dr. Lola Williams, and I love to educate women on our reproductive health, and that's why I came up with this series titled The Lola List. It's my specially curated list of must-know topics for every woman. Today we're going to be discussing PCOS because yes, it seems like every woman has PCOS these days. So let's get into it. As I already mentioned earlier, PCOS stands for polycystic ovarian syndrome. However, I'd like to break some things down in this video. Now, the name is a little bit misleading because most people believe that because it says polycystic, then it means that they must have ovarian cysts, and this is not true at all. PCOS is mostly a hormonal issue and it affects how your ovaries work. A lot of people want to know what causes PCOS, but the cause is not known. There is some genetic factor to it in the sense that it does run in families. However, I'm going to break down some of the other things that happens when a woman has PCOS. Now, the first thing that happens in PCOS is having higher than normal levels of androgens. Hold on, I'm not going to get too scientific on you, okay? Now, we all know that we have both male and female hormones, and the male hormones are called androgens. Now, in women with PCOS, what scientists have found is that they have higher levels of those male hormones called androgens, specifically testosterone. Now, these high levels of androgens can interfere with ovulation, which is the release of an egg by the ovaries, and this typically happens monthly in a healthy female who has a regular menstrual cycle. The androgens go ahead to affect ovulation, and that's what causes one of the major symptoms which you see with PCOS, which is a lack of ovulation and irregular menstrual cycle. Another thing that we see with PCOS is insulin resistance. Now, insulin is another hormone that is responsible for breaking down sugars or glucose in your body. This is an important point though, because insulin resistance can actually lead to increased level of androgens as well. Insulin resistance is also the reason why women with PCOS are more prone to developing diseases like type 2 diabetes. Now, we call this condition polycystic ovarian syndrome. Why exactly is it being called polycystic? Based off what I've just explained to you, some things are going to start to make sense. The reason their ovaries look polycystic is because it ends up containing a lot of follicles. Because their body is releasing more of male hormones and not necessarily the female hormones that can help ovulation follow through, they end up having a lot of immature eggs left over in their ovaries, and this is what gives it that classic polycystic appearance. So basically what you see on ultrasound are small follicles with immature eggs that end up making the ovary appear polycystic. You're probably starting to understand PCOS a little better, so let's dive into the symptoms. With every condition that I discuss on here, I want to make it very important to note that some will appear with symptoms that might be very exaggerated in some women, whereas some women might have little to no symptoms as well, and that is also very, very true for PCOS. While it is one of those disorders that's very talked about in regards symptoms, I want you to also realize that you might not have any symptoms, and most women do not realize that they have PCOS until they start struggling with either fertility or unexpected weight gain. The first symptom of PCOS that we're going to be talking about are irregular periods or no periods at all in some women, and this happens obviously because there is no ovulation happening, or there's irregular ovulation happening as well. As I explained earlier, they have more male hormones and therefore their ovaries are producing eggs, but these eggs don't get matured enough to be released. With PCOS, you might also see unwanted or excessive hair growth. We refer to this as hirsutism. Now, women with PCOS may have hair growth in unwanted areas, and most times you would find that they're having those hair growing in areas where men would typically have hair grow. So I'm talking on their chest, on their tummy, on their chin. These are all symptoms of having excessive androgens, which is key in PCOS. Acne is also another symptom of PCOS that a lot of women experience. Women with PCOS may also suffer from thinning hair on their scalp, and they may also have darkening of their skin, especially around their skin folds, like in the neck and in the armpits. And this is something we refer to as acanthosis nigricans. And another very key point to note is that this is a very big sign of insulin resistance. And obviously, one of the biggest symptoms of PCOS, which I believe is one of the reasons why it's being talked about much more now, is infertility. Obviously, if you're not releasing eggs and you're meeting with your partner monthly, then there's no egg for the sperm to fertilize. And that's why women with PCOS end up struggling with having babies. Now let's get into diagnosing PCOS. How do you know that you have PCOS? I always emphasize on this channel the importance of speaking to your doctors, because diagnosis is not one size fits all. For diagnosis, we use something called the Rotterdam criteria. Now this means that if you have 2 out of these 3 symptoms I'm about to mention, then it's very likely that you have PCOS. 3 symptoms are: 1, irregular menstrual periods; 2, any signs of increased androgens like acne or unwanted or excessive hair growth, which is Sutism that we already discussed; and 3, polycystic appearing ovaries on an ultrasound scan. Now let's talk about management, because there are solutions. Unfortunately, PCOS does not have a cure. It is one of those things that you have to live with for the rest of your life. But I don't want anyone with this condition to feel discouraged, because there are so many solutions available to you. And it's very important to always speak up so that you can find out. You can definitely still live a full and healthy life with PCOS, and you can definitely have children. The first medication we will typically prescribe for women with PCOS is birth control, because this can help to regulate your hormones, and it can also help out in cases where the woman is suffering from acne as well. Anti-diabetic drugs like metformin can also help with symptoms because of the insulin resistance. Last but not the least, let's talk about the role of nutrition and movement. Lifestyle changes can actually be super powerful when it comes to managing PCOS. Factors like overeating, lack of physical activity, or being overweight can contribute or even worsen your symptoms. So lifestyle changes like eating healthy and being more physically active will greatly help. When it comes to physical activity, you honestly do not have to do too much. Taking a walk, doing some yoga, and even weightlifting will help a lot. So there you have it, the Lola list on PCOS. 3 things to take away. It is common, it is hormonal, and you don't have to go through it alone. So if this video has been helpful to you, or you think it will be helpful to anybody else that you know, please make sure to like, share, and don't forget to subscribe. If you have any questions or comments, you can leave them down below in the comment section, and let me know if you should do a part 2 on this topic, because I know PCOS is one that a lot of people will have questions on. Anyways, that's all the time I have for today. Thank you so much for tuning into another episode of the Lola List, and until next time, it's me, Dr. Williams, at your cervix. Bye.